Greetings. My name is Kate Mahoney. I'm the Executive Director of the Naomi Ruth Cohen Institute for Mental Health Education at the Chicago School of Professional Psychology. I'm really excited today to have joining us Joe Feldman, who is on the board of the Kennedy Forum, Illinois.
Good evening.
And a dear, someone who's a friend, a great advocate, and really I want to say Joe is actually, to me, a hero. And he's a hero because he's been such a great mental health advocate, first of all, for loved ones, and then really trying to spread the message. So I'm really happy to have you here, Joe, and I want to share really quickly so people can see right away the Kennedy Forum's website in case people want to be connecting with the Kennedy Forum, Illinois, and all the wonderful information. We'll make sure that a couple of times throughout the show we let people know that we're here and they can see the Kennedy Forum and what all wonderful programs that you offer. So, Joe, I know when we've talked a little bit in the past, and part of why I wanted to bring you on as a guest, is that as we work on being advocates for mental health and really trying to increase access to care, one of the stumbling blocks has often been people not getting access to the care they need because they run into barriers with their insurance companies. Even sometimes when they have things listed in their policy, covered services for mental health and substance use services, which now is the law both nationally and certainly in Illinois, we have a very strong parity law. But a lot of times people get told, no, there's not a need for that service. We don't cover that service. So can you tell us a little bit about your experience and also what you might advise for people who've had similar experiences?
Sure. So first of all, thanks again for inviting me on. It's a great opportunity to share a little bit of my experience and to talk about the challenges that that we faced and to some extent overcame regarding insurance denials related to mental health care. I mean, the reality is that too often insurers say no or otherwise limit the amount of health care or the specific treatment programs that are available to their insureds. It's certainly been my own experience in talking with others who've been advised by their doctors or by their family's doctors that certain treatment is appropriate and based on their experience it's medically necessary. And then the physicians say, and we sure hope the insurance company covers it and sort of good luck, see how it goes.
And sends them on their way to deal with the insurance, right? Right.
And insurance companies, as I said, sort of too often will look at the treatment program and say, we're just not going to cover that. It's not medically necessary. Our experts have looked into this case and have decided it's not appropriate, and therefore we're not going to cover it. There was a study published just a few weeks ago by an organization called Feldman, which looked at how access to mental health services compares to physical health, which, as you mentioned, is the law on a national basis. And there's laws in Illinois as well. And what they found is that it is 6 times more likely that the necessary care for an individual is going to be out of network, which compared to physical health. And for children and adolescents, it's 10 times more likely that the necessary care is only going to be available out of network, which creates big problems for payment. And creates a barrier for the insurance company to say we don't cover that particular care. And by the way, it's only available out of network at a dramatically reduced level in any case.
And so one of the things that seems to me is one of the problems is that when healthcare companies are building their networks, that they just don't plan enough for the critical healthcare issues of mental health care and substance use disorder treatment. And so they make sure that there's oncologists and there are nephrologists and all sorts of things people might need for cancer treatment, for diabetes care, etc. But they don't seem as committed to building a robust network so that an individual with a mental health or substance use disorder or both would get access to the kind of treatment that they need. And when things are out of network, often if things are paid at all, they're paid at a lower percentage. So that seems like very short-sighted on the part of health insurance companies, that they're not really from the beginning, they're not setting the system up to really work for people.
Right. Well, sadly, this is a very old problem. I mean, it goes back many, many decades where individuals seeking access to mental health care or substance use care go to their insurance companies with a claim, and the insurance company says no. And frankly, the challenge of overcoming an insurance company saying no is very, very hard. And if you are fighting with some mental illness, or you have a substance use issue, or someone in your family does, you're probably consumed with getting the care you need, and having an insurance company say no is considered something that's black and white. It's not something I'm going to spend time fighting. The idea of filing an appeal is not appealing. I think that's safe to say. And it's really only over the last maybe 10 years or so that laws have been put on the books, starting most significantly with the Mental Health Parity Act, which was put into law by Congress 11 years ago. That's a real step in the right direction. Certainly not the last word on the subject, but that law is relatively clear in saying that insurance companies must treat mental health care on parity, on the same basis as they treat physical health. Now, that doesn't mean that because the law is on the books that compliance is going to occur right away. In fact, compliance is still far less than it should be. But advocates like the Kennedy Forum, litigation that holds health insurers to account, those are steps that bit by bit are going to make a difference. And hopefully over time, insurance companies will treat medical care above the neck the same way they treat health care below the neck.
Which is really important. And, I remember being an advocate that it took a long time to get the federal law passed. And then I was very pleased in Illinois that we have a parity law in Illinois that's actually considered to be one of the best state laws on parity of mental health and substance use disorder treatment. Really one of the best in the country in terms of that we really wrote a pretty comprehensive law in Illinois. But the issue is still, I think, first of all, you mentioned it, when you have a family member who has any significant health issue, whether you have somebody who's living with a mental illness, a substance use disorder, a serious physical issue like cancer, you're so busy caring for your loved one that when you start bumping into these barriers, bureaucracies who say this is not covered, it's not part of your plan, that it's really easy to sort of accept that at that moment because you're exhausted and you're dealing with the day-to-day. And yet what we really need more advocates doing, whether it be individual family members or people like the Kennedy Forum, out there really saying this isn't okay. And health is health. And it really seems to me, and I'm not sure your thoughts about this, that a lot of this comes from stigma, this thought that we can treat people differently because they have a substance use disorder or a mental illness.
Yeah, I think that's right. Certainly when care for mental health or substance use is suggested by a physician, there are a lot of challenges that are inherent in that treatment plan that are different in many ways from lots of different other health care. For example, there are often symptomatic issues to deal with: anxiety and depression and substance use or other combinations. The path towards returning to good health is not a straight line. There's often 2 steps forward, 1 step back. That can be a significant challenge. And so when the insurance company says, no, that treatment's not appropriate, or no, that treatment has not had the effect that it should, therefore we're going to discontinue coverage, or that treatment has been extremely effective and therefore you've now progressed and therefore it's not needed anymore. There are lots of different, I'll say, reasons for denial that insurance companies have at their disposal. And I think it's not. I'm not going to impugn the intent of the insurance companies, but I will say that the recognition that mental health requires really following the lead of the physician, that's whose patient it is absolutely critical. And having a rule book that purports to provide all the guidance that's necessary as to what should be covered or not, it just doesn't make sense. The physician or the therapist or the other care provider who is dealing day to day with the patient is really the one who can determine best what's medically necessary and what's medically appropriate.
That makes a lot of sense. I think we have a caller, Joe. So I want to see if the caller wants to weigh in on some of what we're talking about. Caller?
Yes, and good evening, and thank you for taking the call. Listen, I had a stroke in March.
Can you speak up a little bit louder, caller?
Yes.
Yes.
I had a stroke in March. It's called dysphagia. I couldn't talk for 2 or 3 days. So just in case I say something, don't hesitate. Ask me to repeat it again. I will do better. Listen, why we do the patients like this, called dual diagnosis. You know what that is. You get a patient with a mental illness. He might be addicted to some drugs or something. You can admit the patient for addiction and then treat the other illness for mental illness. Because it's a shame a lot of people out here need help, but they get no help. So you can always meet a patient as a dual diagnosis. Listen, let me get up the air. Thanks for taking the call. I want to hear your response.
Okay.
Again,
Thank you so much for calling. And I think you raised this important issue that, Joe, you've touched on a little bit, but I think our caller really hit it home about the issue about dual diagnosis. People who might have a traditional mental health disorder like severe depression or an anxiety disorder, and they might also have a substance use disorder. Many people, they initially get involved with using substances as a way of trying to self-medicate or cope with some of the symptoms of a mental illness, and then the substance use also brings on its own set of problems. And one thing I wanted to highlight as we're talking about these things is, is these also affect our physical health, that when you're living with a substance use disorder, it can affect all many of our organs, issues about our liver, issues about our blood pressure, a variety of things. Similarly, that when you are living with severe depression, you can have symptoms that are sleep disruptive or disruptive to your appetite. So we can't really separate out mental health, substance use, physical health. It's all really integrated. And I think our caller was really trying to make sure that we're helping our providers, first of all, helping families who might have someone who's living with a mental health and substance use disorder to realize, there's a name for it. We talk about that as being dually diagnosed, having two, that we need to be able to fight to get comprehensive treatment that would address all those problems. So it was really nice to have someone really, I think, again, share their own concerns. It's
good reinforcement. And I think for providers, one of the things that is very common, as I mentioned earlier, providers will say, we hope this is covered by your insurance, and you'll have to file that claim separately. But one of the things that providers can do and patients can ask them to do is to document the physician's or the therapist's assessment of the case with what I call a medical necessity letter. So it's writing down on a piece of paper, and it can be as short as 1 page. It needn't be extraordinarily comprehensive, but it documents in a very professional way that physician's or that provider's assessment of the individual that they are treating, and based on their experience, the recommended course of treatment. That sort of letter can be extremely useful with the insurance company by saying, by submitting it as part of a claim to say this treatment has been approved and is recommended and has been deemed medically necessary and medically appropriate by my physician. And that is a step towards insurers complying with the law and with their policy for covering that medically necessary care.
I think that's great advice, and I want people to see some of the strategies that you have on the website for the Kennedy Forum that really talks about how to get insurance coverage for your mental health and or substance use needs for yourself or for a loved one. And so that's a great resource that you offer. The Kennedy Forum website is filled with great resources. So I wanted to make sure our viewers had a chance to see that and are really looking that up. And that we're really thinking about this has to be a partnership. So the individual living with a mental health condition or a substance use disorder, hopefully their loved ones, because when you're living with one of those health conditions, it's hard to be your own advocate. You need family members, friends, loved ones. I know I have sat down with people and said, I will sit with you and we can call your insurance company together, because it can feel overwhelming. And then we also need, whether it be a therapist, a psychiatrist, a mental health, community mental health center, a local substance use treatment program, that the providers are working to support the patients and their family members in terms of getting access to coverage, because this is expensive. Most people can't afford to get the care for their loved ones if there is not some form of insurance support for it, whether that be Medicaid, Medicare, private insurance, and HMO, all sorts of things. But we need to help people navigate those systems, because it can be a little bit overwhelming. And part of why I say you're my hero, Joe, is that you didn't give up fighting in spite of having insurance companies say, no, we don't pay for that, we're not going to cover that. You, for your loved one, said, we're going to get her the help she needs no matter what, right? Right.
So I was really fortunate in a lot of respects. Our daughter had some really significant challenges early in high school. And after trying a variety of different treatment plans and finding that none was working at all, her physician said, there's a particular course of treatment. It's going to be much more intensive, and that's going to be what's necessary for her to successfully return to good health. And so we pursued that course of treatment, and I can say now, years later, that was successful. One of the things that I would say really made me quite lucky is that very shortly after our daughter began this course of treatment, I was having breakfast with a friend of mine whose daughter had her own set of challenges. And this friend of mine said, by the way, you should expect to have no help from your insurance company.
Wow, no help, huh?
And frankly, I hadn't thought about insurance at all. I was 100% focused on our daughter's care and trying to figure out how she was going to get that care. And that signal to me was so important. He identified someone who is in the business of advocating for families that are filing claims related to mental health. I would have never known that such a resource existed. So I was able to work with this particular organization. They helped file the claims. They helped ultimately prepare an appeal after our claims were denied. And they have the experience of dealing with a wide range of mental health issues and mental health treatment programs. And so the work that they did to file the appeals turned out to be absolutely critical. The appeals were also denied.
Wow.
So my friend was right. Our insurance company said no. And we said, oh, yes, you will. And then we filed appeals, and they said no again. And we said, oh, yes, you will. And ultimately, it took a successful lawsuit to hold our insurance company to account. And while that took a long time and a tremendous amount of effort, I feel like we had not just a small victory related to our daughter's care, but as our lawyers have told us now many times, that process will create some precedent that others will be able to point to over time, that certain denials by insurance companies are not appropriate, certain care protocols that the doctors say are medically necessary are appropriate and should be paid. That's that's a bit of a victory, and one that we're really happy to have provided as a stepping stone that others can take advantage of.
It's a huge victory, but I think what you're saying is so important. The first step is there were denials, and you had to not be discouraged, and you had to say, we're going to keep fighting because we love our daughter. And then there were the appeals. So you're like, okay, we're going to appeal these denials. And then those got denied. And then you had to keep fighting. And so the challenge is helping people have that energy and that process to keep fighting and fighting. And what's great, I think, about the work that you're doing as a board member at the Kennedy Forum, Illinois, is saying we can do some fighting together. We can learn from what people have done in the past. So people don't all have to be the pioneers. You've been a pioneer.
Right.
And that there is help available. And so I think the message that you're sending today is, if you have a loved one who's impacted by mental health or substance use disorders or both, there is a way to get help. It might be a long, arduous fight, but there's people that are out there that want to stand side by side or that have even already led the way, and there's a way to make it happen. But we need to hang in there together, and we need to treat this as seriously as we would if our loved one had cancer and someone was saying, you know, that we know your doctor said it's medically necessary, but we're not going to pay for that treatment. And what I loved is when you were talking about what the treatments that didn't work and finding the treatment that worked to address your daughter's needs. And all too often, I feel like in mental health and substance use, we've kind of, when the treatment hasn't been effective, we've sort of thought, well, maybe the patient wasn't working hard enough or trying hard enough. But instead, recognizing we need to match the treatment with their condition, and that each of us is unique. And so if we've tried lower levels of care that are less expensive, and truthfully, you know, they are less intrusive to somebody's life, some people get better with a low level of care. Other people need a more involved intervention, a more involved treatment plan, and that usually means a more expensive treatment plan. But that's why we have insurance. That's why we've all, our employers, for many of us, pay for our insurance, but we also are paying part of that bill and co-insurance and co-pays. We want to make sure that when we're really investing in our health, it's our whole health, including our mental health and substance use needs, and that we're getting what we pay for, and that when these plans say they cover these things, or the law mandates that they cover substance use or mental health and parity, that they really are doing it. And I just feel like you are such a hero that you held the insurance company to task to help your daughter and to really pave the way for others.
Well, thank you. I mean, I think the resources that are available to folks that are in this position turn out to be much broader than I had ever imagined. The Kennedy Forum's website provides a number of resources. The article that you had put up on the screen earlier that I submitted as a guest blog post has 10 steps that are supportive of an individual that's interested in getting the care that they purchase through their insurance plan. And I think that provides some great resources. If anybody has questions about their own care or about that blog post, I'd be happy to receive those at an email, joe.insurance.parity@gmail.org.
Gmail.com.
Gmail.com. I think the key message is you are not alone. There are lots of resources that are available. And for family members that are supportive of your effort and who ask, how can I help? Often getting involved in the insurance process may be the way that they can help you the most.
I think that's really wonderful. I'm going to once more just quickly show people the Kennedy Forum website one last time. So you see what you're looking for when you go online. Look for the Kennedy Forum. And Joe, I just can't thank you enough for taking time out of your really busy schedule to be here to share the message. We wanted to come into your living rooms to tell you that there is help available. What's great about when we understand more about mental health and substance use is, prevention works, treatment is effective, and people recover. But they recover when they get the care that they need. So thank you so much. Thank you, Joe, for this evening.
Thank you very much.
We'll see you again soon.